My name is Nalini Rajamannan, and I'm a visiting scientist at the Mayo Clinic, and I practice in Sheboygan, Wisconsin. And my presentation was presenting data on mechanisms of bioprosthetic valve calcification. So for decades, native aortic valve calcification and bioprosthetic valve calcification was thought to be due to a wear and tear process where the leaflets degenerate, and then over time you'd have to replace the native valve or replace the biological valve if it develops calcification. And now in the last 20 years there's been a large number of studies which have demonstrated that native valve calcification is due to a stem cell, circulating stem cell, or native mesenchymal cell which turns to bone. And we tested that hypothesis in bioprosthetic valves to try to determine if there was the role of lipids and the role of statins to try to improve this process. So there were two parts to the study. One was looking at human valves, biological pericardial valves that were removed at surgery, and we found that those valves had markers of bone formation and also markers of stem cell, presence of stem cells on the valve leaflets. And then the second part of the study was taking normal pericardial valves and implanting them in an animal model and testing with high cholesterol diet versus statins. And the results demonstrated that in the high cholesterol diet that the valve leaflets developed atherosclerosis, bone formation, and also evidence of stem cell activation on the valves. And the treatment with statins attenuated the process. So there's a hypothesis out there with experimental data which indicate that there may be a role of statins. It's not an FDA indication, but the questions that were asked at the session were, would you treat patients who have valve replacements, either surgical or TAVR? And I say if there's a clinical indication with elevated cholesterol, definitely I would start the patient right as a valve is being placed and then continue on lifelong if they can tolerate it.